If we are going to bridge the gap between science and policy, as we saw in the experience of Azerbaijan, the young scientists need to be trained, they need to be nurtured, they need to be supported. I cannot in any way overstate the need for that, because as we're all aging, there's going to be a huge gap between the capacity that exists with the problems that we're faced with, and they're not going to be able to be addressed without adequately trained professionals serving the public interest above any other interest. So people need to be trained to understand the values of public health, and if people understand those values in the way that we've heard at this conference of issues of dealing with equity, accountability, protecting the most vulnerable in societies, which range from indigenous peoples to children, the fetus, to immigrant populations, to refugee populations. If we protect these most vulnerable groups, then I think it should be seen as a no-brainer that we're protecting everybody. But the real issue for me is society being led in a way that encourages the application of the principle of equity? There is some large sentiment out there and demonstration that people don't really care a whole lot about the notion of equity, and I cannot overstate again the folly of that kind of thinking. If we don't learn from history, we're only destined to repeat it. And if you have growing inequities and growing disequilibrium in society, this is a major formula for grave social disruption. When you overlay on those kinds of dynamics in society issues of global change and globalization generally, thinking specifically of what people are probably most aware of, and that is the changing climate, global warming, the greenhouse effect, overlaying that concern on all of the other concerns that are embraced through globalization and through the issues of global change more broadly, whether we're talking about overpopulation issues, whether we're talking about the abuses of technology, whether we're talking about the ills of affluence, the overconsumptiveness and the legal and illegal distribution of wastes, not in my backyard syndromes. All of these problems brought together dictate to me the need for tremendous capacity building in developed as well as in developing parts of the world, because people in developed parts of the world also need to understand from the very nature of the questions they asked, they need to think about whose interests are being served by addressing those questions. And to me, addressing the question in the context of global equity, I think would refocus the questions and rechannel the energies into addressing perhaps what are more important and relevant questions to the survival of humanity